Gentlemen, let's have an honest conversation about something many men experience but very few openly discuss. If you've noticed weaker erections, reduced sensitivity, less stamina, or a decline in sexual confidence over the years, it's easy to assume that aging alone is responsible. While age can certainly influence hormonal balance, circulation, and energy levels, there's another factor many men overlook completely: long-standing habits surrounding masturbation and sexual stimulation. For decades, countless men repeat the same routines without ever questioning whether those patterns might be affecting their body's natural response system. Over time, the brain, nerves, blood vessels, and muscles adapt to repeated behaviors. Certain habits can gradually train the body toward reduced sensitivity, weaker arousal, and performance difficulties. The important thing to understand is this: the body is adaptable. Just as unhealthy patterns can condition the body in the wrong direction, healthier habits can retrain it toward improved sensitivity, stronger erections, and renewed confidence. In this guide, we'll explore 4 of the most common masturbation mistakes that may contribute to erectile difficulties, particularly for men over 50. More importantly, we'll discuss practical ways to correct them naturally and support better sexual wellness. Understanding the bigger picture. Erectile dysfunction is often treated as though it's simply an unavoidable consequence of getting older, but the reality is more complex. Yes, testosterone levels gradually decline over time. Blood vessels can become less flexible. Recovery times may lengthen. Stress medications, poor sleep, and health conditions like diabetes or high blood pressure can also play a role. However, another major factor is conditioning. The nervous system learns through repetition. If the brain repeatedly associates arousal with a certain type of stimulation, pressure, speed, or visual input, it can begin to rely on those exact conditions in order to respond strongly. Over many years, this conditioning may create a mismatch between what the body has become accustomed to and what occurs during natural intimacy. The result can include reduced sensitivity, difficulty maintaining erections, delayed or rapid climax, reduced enjoyment during intimacy, performance anxiety, lower confidence. The good news is that these patterns are often reversible with patience and healthier habits. Mistake number 1, depending on adult content every time. One of the most common habits affecting sexual response today is the constant use of highly stimulating adult content during masturbation. At first, this may seem harmless. Modern technology provides unlimited novelty, instant access, endless visual stimulation, and constant variety. For many men, it becomes a routine part of arousal. But the brain was never designed to process such an intense and endless stream of stimulation. Natural arousal typically develops through a combination of emotional connection, anticipation, touch, scent, imagination, and physical closeness. When the brain becomes accustomed to rapid-fire novelty and extreme visual stimulation, it can begin adapting in ways that reduce responsiveness to ordinary intimacy. This adaptation involves the brain's reward system. Dopamine plays a central role in motivation, excitement, and sexual arousal. Repeated exposure to highly stimulating content can lead the brain to expect increasingly intense input in order to achieve the same level of excitement. Over time, some men notice reduced excitement during real-life intimacy, difficulty maintaining erections without visual stimulation, less sensitivity, increased distraction during intimacy, greater performance anxiety, a need for more extreme or novel material to feel aroused. This does not mean someone is permanently damaged. It simply means the brain has adapted to a certain pattern. How to begin reversing it? The solution is not shame or fear. The goal is retraining. Reducing dependence on screens allows the brain to reconnect with more natural forms of arousal. That can include using imagination instead of videos, focusing on physical sensations, slowing down the experience, becoming more mindful of breathing and touch, reconnecting with emotional intimacy and real-world attraction. At first, the transition may feel uncomfortable. Some men experience lower arousal temporarily while the brain adjusts. This is often referred to informally as a reset period. With consistency, many men report improvements in sensitivity, spontaneous erections, emotional connection, confidence, responsiveness during intimacy. The brain is highly adaptable. Healthier stimulation patterns can gradually restore a more balanced response system. Mistake number 2, misusing edging. Edging refers to bringing oneself close to climax and then stopping before orgasm. When practiced moderately, edging can help improve awareness, stamina, and control. Some men use it as a way to better understand arousal and reduce premature ejaculation. The problem occurs when edging becomes excessive. Some men repeatedly push themselves to the brink of climax over long sessions lasting an hour or more. They cycle between extreme stimulation and sudden stopping again and again. This can place significant strain on the pelvic region and nervous system. During intense arousal, the body increases muscle tension, blood flow, and nerve activity. Repeatedly interrupting that process for prolonged periods may lead to pelvic floor fatigue, increased tension in the pelvic muscles, reduced erectile quality, difficulty reaching climax, overstimulation of the nervous system, temporary numbness or reduced sensitivity. For some men, excessive edging can create frustration because the body becomes confused between stimulation and restraint. A healthier approach to edging. Balanced edging focuses on moderation rather than marathon sessions. Helpful guidelines include avoid pushing right to the point of climax repeatedly. Take breaks earlier while still relaxed and comfortable. Keep sessions shorter and less intense. Pay attention to pelvic tension and breathing. Allow the body to complete the arousal cycle naturally. The goal is not to battle against the body, but to work with it. When practiced gently and intentionally, edging may support greater awareness and control. When overdone, it can exhaust the very systems responsible for healthy erections. Mistake number 3, rushing through the experience. Many men develop the habit of rushing toward climax. In younger years, the body may recover quickly from fast, high-intensity stimulation. Testosterone levels are often higher, circulation tends to be stronger, and nerve sensitivity is greater. But as the body ages, speed-based habits may begin working against erectile health. Quick stimulation often encourages shallow breathing, muscle clenching, and incomplete blood flow to erectile tissue. Healthy erections depend heavily on circulation. When blood vessels relax properly, blood fills the erectile tissue more completely. If stimulation becomes rushed, tense, or overly mechanical, the body may never fully settle into a strong state of arousal. Over time, this can contribute to shorter-lasting erections, reduced erection firmness, increased anxiety, less satisfying climax, conditioned rapid ejaculation, reduced overall enjoyment. In many cases, the body simply becomes trained to expect speed rather than gradual arousal. Slowing down supports better function. One of the simplest and most effective changes is slowing the entire process down. Instead of focusing only on climax, focus on the experience itself. This includes deep, steady breathing, relaxing the pelvic muscles, reducing unnecessary tension, paying attention to sensations throughout the body, allowing arousal to build gradually. Breathing is particularly important. Slow breathing activates the parasympathetic nervous system, often called the rest and relax system. Erections depend heavily on this relaxed physiological state. Stress, rushing, and anxiety activate the opposite system, the fight or flight response, which can interfere with erections. Some research also suggests that proper breathing and vascular relaxation support nitric oxide production, an important factor in healthy blood flow. Nitric oxide helps blood vessels expand, improving circulation throughout the body, including the pelvic region. When men slow down and reduce tension, they often notice stronger erections, greater sensitivity, improved stamina, more satisfying climax, reduced anxiety around performance. Rather than treating intimacy like a race, it becomes a more relaxed and connected experience. Mistake number 4, the death grip habit. One of the most frequently discussed issues among men experiencing reduced sensitivity is the use of excessive pressure during masturbation. This is commonly referred to as the death grip. The habit involves very tight gripping combined with rapid friction and intense pressure. While it may create strong stimulation in the moment, the body can gradually adapt to that level of intensity. Over time, lighter or more natural forms of touch may no longer feel as stimulating by comparison. This can lead to reduced sensitivity, difficulty maintaining erections during partnered intimacy, delayed orgasm, frustration during sexual activity, increased dependence on intense stimulation. Excessive pressure may also temporarily reduce circulation and place unnecessary stress on sensitive tissue. Retraining sensitivity. The solution is gradual retraining. Many men benefit from using a lighter grip, slowing down movements, using lubrication to reduce friction, varying pressure and rhythm. focusing more on overall sensation rather than intensity alone. At first, reduced pressure may feel less stimulating because the nervous system has adapted to stronger sensations. However, with consistency, sensitivity often begins to return. Think of it like restoring balance rather than losing pleasure. As the nerves and brain adjust, many men report increased responsiveness, easier arousal, better erection quality, more enjoyable intimacy, reduced need for excessive stimulation. This process takes patience, but the nervous system is remarkably adaptable. The role of blood flow in erectile health. Healthy erections rely heavily on circulation. Anything that interferes with vascular health can affect erectile function. That's why lifestyle factors matter so much. Habits that support healthy blood flow include regular physical activity, maintaining a healthy weight, sleeping adequately, managing stress, avoiding smoking, limiting excessive alcohol consumption, eating a heart-healthy diet. Conditions such as diabetes, high blood pressure, obesity, and cardiovascular disease are strongly linked to erectile dysfunction because they affect blood vessels and circulation. In fact, erectile dysfunction can sometimes be an early warning sign of broader vascular problems. If erectile difficulties are persistent, worsening, or accompanied by other symptoms, it's important to consult a qualified healthcare professional. The importance of pelvic floor relaxation. Many men don't realize the pelvic floor muscles play a major role in sexual function. These muscles support blood flow, ejaculation, bladder control, and erection quality. However, chronic tension in the pelvic floor can contribute to discomfort, premature ejaculation, and erection problems. Stress, anxiety, excessive edging, rushing, and constant muscle clenching can all create unnecessary tension. Helpful habits include deep diaphragmatic breathing, stretching and mobility exercises, relaxation techniques, avoiding constant clenching during arousal, regular physical activity. Some men also benefit from pelvic floor physical therapy under professional guidance. Psychological factors matter too. Sexual performance is not purely physical. Anxiety, stress, guilt, depression, relationship problems, and fear of failure can all interfere with erections. Performance anxiety is particularly common. After one or two negative experiences, some men begin monitoring themselves constantly during intimacy. Am I staying hard enough? What if I lose the erection? What if it happens again? This mental pressure increases stress hormones and activates the fight-or-flight response, which can directly interfere with arousal. Improving sexual health often involves reducing pressure rather than increasing it. Confidence tends to return gradually when men stop treating intimacy like a performance test and start reconnecting with relaxation, pleasure, and emotional connection. Building healthier habits moving forward. Improving erectile health rarely requires perfection. Small, consistent changes often create the biggest long-term results. A healthier approach may include 1. Reducing overstimulation. Limit constant reliance on highly stimulating visual material and reconnect with more natural forms of arousal. 2. Practicing moderation. Avoid marathon sessions, excessive edging, and overstimulation. 3. Slowing down. Allow arousal to build naturally with relaxed breathing and reduced tension. 4. Using gentle stimulation. Reduce excessive pressure and retrain sensitivity gradually. 5. Supporting overall health. Exercise, sleep, nutrition, stress management, and cardiovascular health all directly affect erectile function. 6. Seeking medical guidance when needed. Persistent erectile dysfunction can sometimes signal underlying medical conditions that deserve professional evaluation. A final word of encouragement. Many men silently assume that declining erections automatically mean they are too old or permanently damaged. That belief often creates unnecessary hopelessness. The body changes with age, but it also adapts. Nerves can regain sensitivity. Blood flow can improve. Confidence can return. Habits can be retrained. Sexual health is influenced by physical conditioning, mental patterns, circulation, hormones, stress levels, and lifestyle choices. That means there are often multiple areas where improvement is possible. The most important step is awareness. Once you recognize the habits that may be working against you, you can begin replacing them with habits that support healthier function. That doesn't happen overnight. Like any form of physical conditioning, progress comes through consistency. Even small adjustments can make a meaningful difference over time. Maybe the first step is reducing overstimulation from screens. Maybe it's slowing down and breathing more deeply. Maybe it's easing up on pressure and allowing sensitivity to recover. Maybe it's improving sleep, exercising more regularly, or finally discussing concerns with a healthcare professional. Whatever the starting point, the goal is progress, not perfection. Aging does not automatically eliminate pleasure, intimacy, or confidence. In many cases, healthier habits and better awareness can significantly improve sexual wellness and quality of life. Your body responds to the signals you give it repeatedly. Train it with balance, patience, and healthier habits. And over time, many men discover that stronger erections, greater sensitivity, and renewed confidence are still very much possible.